everyone, this is Dr. Daphne here at HealthFit, and today I want to talk about something that's come up pretty frequently in my recent visits with patients, and that's with sleeping. And I realize a lot of the reasons why my patients come in with all this discomfort and waking up feeling not as refreshed is because their pillows are not at the height that they're supposed to be. It kind of depends on what position you prefer sleeping in, whether you're a side sleeper or a back sleeper or a stomach sleeper. Ideally, try not to be a stomach sleeper because that really kind of puts your head in a really uncomfortable position, and that's kind of hard to modify. But when it comes to side sleeping and back sleeping, the pillow should ideally be fitting either right at the back of your neck or on the sides of your shoulder. So back of your neck, there's a curve right here, and ideally you want that pillow to fit right in that curve here so that your spine stays aligned and straight or in a neutral position. And then when you sleep on your side, you want to make sure that the pillow is wide enough to cover this angle between your ear and your shoulder, because that way your spine stays nice and neutral as well. So we're going to hop over it and see what that looks like, what it looks like when it's in a bad position. So if you're going to sleep on your side, I'm a side sleeper, so I tend to sleep on my left or my right shoulder at night. I notice that as soon as I'm in this position, completely on my side, my head is not in a very comfortable position. So ideally, when you go to sleep at night as a side sleeper, you actually want your head a little bit more elevated, because as of right now, you can see my spine, it's not straight. So the body is straight. Well, as soon as it hits my neck, it kind of goes and slants downward. Whereas ideally, you want the whole thing to be completely straight. So my neck should ideally be up here, and that way I can sleep in a neutral position. Before, when I used to sleep on a bad pillow, what would happen was that I would wake up with a lot of upper neck and mid-back stiffness, and I would feel really achy in the mornings. But ever since I changed that, now I wake up pretty comfortably and I feel pretty good. Also, if you're sleeping on your back, ideally you want the positioning to have that space in between here. This pillow is actually a little bit flat for me because right now I feel like I'm looking up and over and kind of behind me instead of in a neutral position. So ideally, for your neck to be in that good straight spine, you want it to be slightly elevated so that everything can stay straight, because if you're too far back, it'll cause some pressure in the middle of the neck. If you're too far forward, sometimes it causes pressure here in the mid-back as well, and you might have some discomfort on the upper part of your neck here. So let me show you a good example of what a good pillow looks like, so that way you have an idea of what an aligned spine looks like when you sleep. As you can see, this pillow is designed in such a way that it's more built up on the front than it is on the back. Your head goes on the pillow, and ideally that space between your neck and your shoulder is aligned with this. So this is the pillow that I actually have at home. This is our one that we have in the clinic, so I'm going to show you what that looks like when I go to sleep on it. So as a side sleeper, there's a bigger gap between my ear and my shoulder here than there would be in the back of my head if I were a back sleeper, from the back of my head to the bottom of my shoulders. So right here, this fits me perfectly, so I don't feel like I'm like crunched over or I have to open up to try to get that pillow to align well. I feel very supported here. This pillow doesn't sink in either. It's very firm and supportive, despite being soft, so it's super comfortable and I can go to sleep on it in this way. So instead of my head being too far up or too far over, I'm actually nice and aligned here and very comfortable. I don't feel like I'm holding myself up. You can clearly see the alignment from my nose to my neck and to my sternum and my chest. They're all in a straight line as opposed to in a crooked line. So this is a side sleeper pillow. And then let me show you what it looks like to be on the back sleeper pillow. So this pillow, the green one, is for if I were to be a back sleeper. So clearly compared to the blue one, the build in the front is a lot lower compared to that one, because the space between the back of my head and the back of my shoulders is lower than it is when I sleep on my side. So if I were to lay down on my back here, you can clearly see that this supports that curve right between the back of my head to the back of my shoulders. Here I feel very much straight. I don't feel like my head is cocked up too high or slanted backward too high, so I don't feel like looking behind me. I feel like I'm actually looking straight up, and my neck feels like it's in a pretty good position. This way, when you sleep at night, your neck is nice and aligned and straight, so when you wake up in the morning, you won't wake up in a way that feels uncomfortable or achy. Because if you look at that gap here, it fits right in that space between this curve here. So it's really important when you get a pillow to make sure that it does fit in these spaces comfortably so that you can get a good night's sleep. So guys, that's everything about pillows. If you guys are feeling that you're having issues at night and waking up with pain in the morning, or if you're not getting a good night's sleep, the answer might be that you might need a new pillow. And the good thing is here at HealthFit, we actually have custom fitted pillows that will match the gap between your ears and your shoulders based on your measurements. What we do is we take measurements from the height of your ears, around your neck, and also the width of your shoulders, and that'll give us a good idea of what kind of pillow fit will be best for you. So guys, if you have any questions or you'd like to come in for a consult, please go ahead and give us a call or leave a comment down below. Thanks guys, have a great day.